I actually started off with studying pharmacology. Really love connecting with people, finding out more to their story. All of my clients have ADHD. A lot of people with ADHD have received so many negative comments in their life. They have a huge challenge when it comes to executive functioning, organization, time management, procrastination. That's what ADHD is like.
Welcome back, everybody, to another episode of Through Help and Back. We are filming in late September. It is a beautiful, crisp kind of New England day. We're getting some remnants of summer here. I think the summer vibes are lingering, and they've been affecting myself and Ian all day. We're kind of we're ready for fall. It's like pumpkin spice everything, but it's still 90 degrees outside. So we're having a little bit of cognitive dissonance there with that. Very excited for today's show. We're going to get into subject matter and a topic that is very near and dear to my heart, and that if anybody who's worked in behavioral health has certainly had contact with this issue as one of the predominant issues in psychology and psychiatry right now. We are going to talk about attention issues, attention deficit disorders, attention deficit with hyperactivity, probably a little bit inattentive type. I mean, we're just going to go across the spectrum. We're going to talk about all that. And I'm really psyched for it because I don't know about you, Ian, but I feel like maybe, maybe I have intermittent ADD. I feel like I'm afflicted with this sometimes. I'm not formally diagnosed, but Ian, you're a younger guy. You grew up with this concept. I didn't know what the hell ADD was when I was growing up, but you've known it your whole life. So what's your take on ADD and ADHD?
Wow, really putting me on the spot here.
Yes, Ian, tell us all you know about this, and don't get it wrong because we're going to judge you.
Well, I think we all have a certain degree of it, but that's all I'm going to say.
Yeah?
I think it varies even. Some days I have more problems focusing. Some days it's less of a problem to focus on things.
Yeah.
Sometimes I'm more hyperactive. Sometimes I'm less.
Right. Well, I think that's what we're gonna try to parse out is how much of this is just normal ebb and flow of our attention. And for those of you who've been watching the show, producer Ian is the man when it comes to organization and detail. So he would probably be the last person I would ever think would suffer from these issues, but to hear him talk about having it intermittently or wondering, from time to time, that's interesting to talk about. So let's bring in a real expert who can clean this up before we go too far down the wrong path. I have Dr. Janina with us today. She is a psychologist and she is an ADHD coach. She is working out of the New England area, which is a plus. We love a local. Everything's local up here, so we like a local that way. But she has traveled the world and she is working with people across the globe on this issue, which kind of indicates to us that we're all dealing with this. So, Dr. Janina, thank you so much for being here. How are you today?
Thank you so much for having me on here today. I'm doing very well. Thank you. How are you?
I'm doing really well too. Are you having the same New England experience I am? Is it still hot down there?
Yeah, it's pretty warm. It's pretty warm and it's time for fall.
I agree. We were kind of bantering before about, I've seen a couple leaves start to change, but Dr. Janina is a little farther south and she's not getting it yet. So this is great. So before we dive into ADHD and you educate us and, clean up that issue and talk about all the things we need to know there, tell me a little bit about, your journey to the helping professions, your decision to become a psychologist, and tell me what inspired you to get into this field.
I was always very passionate about science, and biology was always my all-time favorite subject. So I knew I always wanted to go into that direction. And then I actually started off with studying pharmacology, so drugs, how they work. And always what drew my attention the most were all my neuroscience subjects. And that was very, very interesting to me, just learning about also all the different mental health disorders that are out there. So that's how I decided, I want to go into that direction and really work with people or either do research on that, on mental health disorders. And then I noticed that just being in a lab all day by myself isn't really for me. So now I work with people and it's much more fun than working with cells.
I can connect with you a little bit on that experience. When I first got into this, I was going to be a sports psychologist, or something to do with performance. And, I'd always played sports and I thought that would be interesting. But I had the same experience. I was at TCU and I found myself in a lab the first couple semesters with, oxygen masks strapped to my face, measuring output and pipettes and blood tests. And I was like, this has nothing to do with what I actually want to do. So I got out of there as quick as I could. It's interesting to hear about you coming at it from a scientific background, though, right? Because we talk about, psychology and psychiatry. They're very, they're human arts, right? Social, a lot of high human contact and interaction. So sometimes people like myself do that whole, I want to work with humans, and then we sort of learn the science as we go. You've kind of come at it from the reverse. So has that been a challenge, or do you think that's been an asset for you?
I honestly have never seen it as a challenge, because I found it so interesting kind of to see the somewhat origin of these disorders, or like see how they might come about, or what just is different in a brain when they have certain disorders. So I really never seen it as a challenge. And it was just, for me, I always need to understand the why behind stuff. And that's why I love to have that background as well. And then now working with people, I feel like that comes just natural to me. I just love hearing people's stories and connecting with them. So that wasn't really hard for me then to like add to that, I guess.
And you were also coming at this from a different perspective than I, because you didn't, I'm trying to remember your history. You didn't grow up in the States full time. You grew up, was it Germany, or where were you from originally?
So I was born in the US, but then we moved to Germany, and my parents are German. And then for high school, for 2 years, I went back to the US, and then I started studying in the UK.
That had to be phenomenal for your social life, to have to change friends every 2 years.
Yeah.
Well, I mean, was that tough? Did you have problems with it when you were younger, or was it just something you kind of rolled with?
I feel like I got used to it, and I just love connecting with different people and learning their stories, and also just seeing how things are just done differently in different countries, or just even areas of countries. So that was always so interesting to me to see and to learn all these new things and learn new cultures.
Yeah, I think that's a phenomenal reframe. I think about my kids, they're 10 and 13, and we joke about hey, maybe we'll move, and they go into absolute hysterics because they love their patterns and they love their routines and their friends. And my family, a lot of military background. We moved a lot, nothing international, but we moved a lot within the States. And you do pick up that skill of connecting pretty quick, because you've got a new group that you've got to assimilate and kind of become a part of. So there is some benefit, but it's tough. I mean, 12-year-old you probably didn't love it so much,
Yeah, I mean, if you're younger, I think it's just more challenging, because you're just so used to your friends, and that's kind of all you know. And then it's scary moving across the country. And I mean, the US, it's a huge country, so.
Yeah, there's several countries within this country. We talked about that, how New England feels different than the Midwest, feels different from the South and Texas. And then, you get way out west and it's a different thing. So, which is great. I think it gives it some variety, it's nice, but it is a challenge. This wasn't really necessarily on topic, but on the schedule, but it kind of comes up in my mind. Since you've had those other experiences, talk to me a little bit about, the concept of mental health, how people look at mental health, talk about mental health in other countries that you've experienced versus the United States. I'm curious, is this a consistent conversation, or do different populations consider it or think about it in different ways?
I think it's very different depending on the country. I feel like in Germany, people are just becoming more aware of it now in the recent years, and more support is happening now. And there's more access also to the counseling or therapy at universities or schools. Whereas when I studied in the UK, I feel like that was always part of it, and everyone kind of knew about it, and everyone was also very, very open about their mental health struggles and getting help. And then when I also did an exchange in Canada, I also felt that was very a topic, and people were talking about it. And also then in school in the US, at the start of the year, people talked about it, teachers or counselors. And then I also did an exchange semester in China, and I felt like that was definitely not part of the conversation whatsoever.
That's interesting to hear. So in those cultures where it's like less part of the conversation, what is the conversation? Is it like taboo? Like it's just not talked about? Or are there other like coping skills, or are there other mentalities that like take the place? Like, the traditional, like, suck it up and be a man, like in male culture, right? Like there's a big stigma about reaching out for help. I wonder if it's like that, where like other countries are sort of like, we just don't talk about it, like, shh. Or is it like, you've got to be stronger and like it's just pushed to the side? Or is there a third option that I'm not considering?
I feel like in Germany, it was like no one really thought about it, and you didn't even think that someone could have mental health issues. And it's always just these selected few that had to like a horrible childhood and then had a mental health disorder. But I feel like people didn't really think about that an ordinary person who didn't have a horrible childhood could also struggle in their teens or once they're adults.
And then here in America, we have the conversation, good, bad, or indifferent, where it's like, I think some people are like, are we talking about it too much? Like, are we almost creating a problem because it's so much part of the dialogue, right? Like my 10-year-old comes downstairs and she fires off, psychological terms. And I'm like, where did you mean? So YouTube and things like that. So I wonder if the pendulum can shift too far in the other direction, where a bad day becomes a disorder when it's actually just a bad day,
Yeah, or also because I'm like present a lot on social media and post a lot of videos. I often get comments from people and they're like, now you're kind of creating that disorder that isn't even existing. But then I also see some people who are very convinced that they have one disorder because they diagnose themselves, but it might not be that disorder. And I think there comes a danger with that as well.
You have to love the WebMD, like Google search diagnosis, right? And I don't mean to belittle, but it's just sort of like, if you go on there long enough, like you're going to have cancer, you're going to have like the biggest disorder you can imagine, because it's just, you go down the rabbit hole. And it's funny because one of the big issues in our country is drug companies being able to advertise, right? And they advertise this stuff, and some of the verbiage in the commercials is so common. It's like, do you ever just not feel like yourself? It's like, yeah, that's everybody, right? Sometimes we all feel that, but they're like, if you feel that, that's now a symptom. That's now a diagnosable issue. Take this pill and, it'll feel better. So that's interesting. And that's another question too, because with you, you're a psychologist, which for people who don't know, there's a very big difference between like psychologist versus psychiatrist, versus therapist and things like that. Tell me a little bit about your role, because we're talking about drugs and things like that. So tell me a little bit about your role as a psychologist and why you chose that versus, straight therapy or going psychiatry. Because I hear biology and I hear, science. I'm like, that might be a future psychiatrist, but you went a different way.
I guess it also just happened to be that way due to like in the different countries that I studied. Like, for example, if I wanted to become a psychiatrist in Germany, I would need to go to med school, and the system is very different than compared to here. So it wouldn't even be possible. And then if I ever were to move again, which I think is very likely when it comes to
you might, yeah, you have a history.
Then it would be very difficult to also become a psychiatrist just in a different country. And I also feel like as a psychiatrist, at least in my opinion or what I've seen, it's always very technical, and you don't even have time to connect to people because you are there to kind of prescribe them with the right medication, see if the medication is working well, see if there are any other medication options. And for me, as I already said earlier, I really love connecting with people and finding out like more to their story.
You don't think you could get that done in the 8 minutes that a psychiatrist spends with a patient on average? I don't think people really realize that. You have your intake, right, which can be like a half an hour, 45 minutes. But after that, they're spending, 8 to 15 minutes with these guys, and it's a very different relationship.
Yeah, exactly. It's a totally different job.
Definitely. So tell us a little bit more about what a psychologist does. I mean, are you doing a lot of testing? Are you doing sessions? A little bit of both? Like, what does a psychologist spend their time on as opposed to what we just talked about with psychiatry?
So I don't do any testing. I don't prescribe medication. And I do a lot of one-on-one work with my patients or my clients. And all of my clients have ADHD or maybe also then autism. And I work with them on kind of whatever they obviously want to work on. A lot is often confidence building, self-esteem, because a lot of people with ADHD have received so many negative comments in their life and had a lot of negative experiences, especially when it comes to school or work. And then also just working on all these executive functioning skills that often people with ADHD struggle with a lot, like time management, organization, procrastination, task initiation. So that's what I mostly do.
Are you doing a testing in relation to the ADHD and the autism spectrum disorders, or are you taking presumptive diagnosis and then just digging in and doing the actual like day-to-day work of rebuilding and more therapy-esque than testing focus?
More therapy and not testing. So all the clients that come to me already have an ADHD diagnosis.
So of all the disorders to work with autism and ADHD, these are two that are speaking from experience as a therapist and talking with colleagues in the field, two of the more challenging diagnoses to work with. Not that any psychiatric diagnosis is like a layup and super easy, but ADHD has its own particular challenges, and so does autism. Throw them together, and you've got a real heavy lift, you know. So, tell me a little bit about where your interest in these two issues kind of developed. How did you get curious about this, and why did you choose to focus in those areas?
I have ADHD myself, and I was diagnosed during my PhD, but I feel like I knew for a longer time or suspected that I have ADHD, and also many people from my family might have it. So I was always very interested in that topic and always did a lot of research. And then once I got diagnosed, that really became my focus to understand it even more, to really understand how I can also help other people, because I just saw that there is such a knowledge gap when it comes to ADHD or autism. And I really wanted to support my clients or my patients the best way that I could. And so I really specialized in ADHD and tried to learn everything that's out there to learn about it.
I mean, that makes perfect sense because we've talked about this in other shows about how people often become the person they wish they had in their life when they were growing up. And if you were carrying around, if you had suspicions of ADHD or you were struggling in certain ways, and then you got formally diagnosed, you probably wished you had a Dr. Janina to understand you a little bit better and help you through that process. What was your experience with the ADD? Because you said you felt like you had it before you ever knew you had it. What were some of the things and ways in which you struggled? What were your challenges?
So in school, I had a lot of challenges. Like, I was definitely a daydreamer, not listening to the teacher, not knowing what's going on in class. When the teacher told the other students to get up and go outside, I didn't hear it, so I was the only one left in class. I forgot what homework we had to do. I forgot that we had a test today. All these things that were very hard during school because I didn't understand it, or also just sitting still in class it felt like a torture. So these were all the things that I struggled with during school. And then I felt like once university started, it got easier for me because I was studying something I really enjoyed and loved learning. And there was just more freedom. I could get up more. The lectures had longer breaks in between. So that then became so much easier. And I also wondered why suddenly university, even though it's hard, you learn more things, you go more into detail, how that all of a sudden became easier for me.
I think it's really important, that part you said in there about the things that you were interested in, you really were able to like drill down and focus like almost beyond anybody else, right? There's this myth around ADHD, like these are people that are just scatterbrained and they just can't focus. It's like, well, that's sometimes true, but when there's those topics that are novel and interesting and really rewarding, they actually hyper focus and can, really go above and beyond on that. So I think that's an important piece to pull out. You had mentioned too that you said a lot of people with ADHD deal with sort of negative social consequences, negative commentary. Was that also a challenge for you? Did you get like a lot of negative feedback while you were going through that? And how did that affect you if that happened?
Yeah, in school, definitely, because teachers were always telling me, oh, you have so much potential. Why aren't you living up to your potential? Or you seem so quiet. Why can't you like focus on what I'm saying? Because it seems like you're being you're focused. Or why can't you just write neatly? Why can't you just bring your homework to class? So I feel like these are all very typical things most ADHDers hear.
Yes, especially from the school establishment, right? Because it's like, did they throw the gifted underachiever label on you too? That's a real common one with people who are struggling that way. Like, you're so gifted, but you're underachieving in all the ways that matter,
Yeah,
So
exactly. Yeah.
And at 9 years old, you're like, what am I supposed to think about this? What does it mean about me? What about socially? I mean, did you find it? I know you talked about making new friends and things like that. Was there any of that social rejection or any of that sort of like, Janina's too much or she's not reliable? I mean, did you get any of that negative social feedback as well, or did that go better than the teachers?
I feel like I was very lucky when it came to my social life. I never really had much of a problem, and never really forgot to like see my friends, or I wasn't like too much for them. So luckily, I didn't have any negative experiences when it came to that. It was really just school focused.
Well, and school focused in countries that you already said don't really acknowledge mental health in the same way. So they're certainly not getting training on how to deal with that. And that's also not their job, right? Their job is to get through the lessons. And we could do a whole, maybe we will, we could do a whole other podcast on my problems with the educational system, because I just think that it's like, we're carrying forward a lot of the things that worked like in the one room schoolhouse, you know what I mean? Back in the 1900s, and the world has changed and the kids have changed. And I watch my kids go through it and I just sort of scratch my head like, this has got to be awful. Like, it's just, I think we could do better, I guess is what I'm getting at. So,
and it's surprisingly or shocking how it hasn't really changed or evolved that much. Like my nephew, he's experiencing pretty much the same things that I experienced and getting treated, I guess, the same way, which is very, shocking, because I thought there would be more awareness now and more education on how to work with people who can't sit still for hours and hours.
I mean, I went through it with my son recently, and he, to the best of my knowledge, does not have ADHD or anything like that. But even like losing recess as a sixth grader, right? You first through fifth, you got those multiple breaks throughout the day. You go outside, you get some sunshine, put your feet in the grass, fresh air, and you got to junior high, and it was like, nope, class after class after class, and all that went away. And he's a good student. He makes honor roll. He does all those things, but he is internally miserable about the whole thing, because he's like, I'm just bored all day. Like, I just can't, and it's just with no diversion, no break, no nothing. It just sort of feels like this assembly line, and he really struggles with it. He's a quote unquote good kid, and he still has a hard time going like, yeah, I'm a good kid, but like, it sucks being here.
And like no kid or teen or even adult should be like stuck in a room all day long.
I agree. But at least we get them up at 6 a.m. to ride a bus to go do it. That's really important part of the learning experience, because all the teachers need to be off in time to go pick up their kids. So we have to have school done by 2:30, right? So,
exactly.
Anyway, I'll start going. I apologize, but anyway. So one thing I did want to dig in with you from an expert opinion, since we have an expert, let's use your expertise. ADHD probably more than anything else. I mean, anxiety's in there, depression, I feel like it's one of those like really common terms. It's in pop psych, it's in the media, it's in, movies and TV. Anytime anybody's acting kind of scattered, they're like, oh, it's my ADD, So can you give us a little 101? I'm not asking you to go back through your studies, but just sort of like what ADD, ADHD actually are. I mean, we can talk about what they aren't. And I think we use them kind of interchangeably with other terms a lot, but like just the basics of like, if someone has ADD, someone has ADHD, like what are they actually dealing with? Like what's really going on there?
So someone with ADHD, they really have a huge challenge when it comes to executive functioning skills. So organization, time management, procrastination, all these skills, and they severely impact their day-to-day life. It's totally normal that someone forgets their keys once in a while, or they forget to do their homework, or feel overwhelmed and can't plan further ahead. But once these things impact your day-to-day life on a severe spectrum, then that's what ADHD is like. And sometimes it's frustrating to me when people like forget their keys once, and then they're like, oh, I'm so scattered and I must have ADHD, because it just really undermines the severity of the disorder. And then it's often put into that, like, you're so funny, you're like scatterbrain and you don't know what you're doing, even though it can have a severe impact on your life. And also if it's not treated, it can have such a severe impact, and you can turn to drugs, you might turn to reckless behavior, and that can have severe negative consequences for you.
Before we go on, I want to say a few words about Anew Behavioral Health. Anew Behavioral Health is an outpatient provider of mental health and substance abuse services in Ohio and New Hampshire. That means that Anew can successfully treat mental health and substance abuse issues or dual diagnosis if you're struggling with both. Their integrated approach allows for them to successfully address issues related to anxiety, depression, addiction, trauma, and really anything that stands between your life and the life you could be living. You really cannot bring them an issue that they have not successfully treated. They have also solved one of the biggest problems for people seeking help. They have a dedicated team waiting to hear from you at helpnow@anewbh.com. If you contact them today, within 24 hours, you will have heard back from, wait for this, a real live person, and will also have your first appointment scheduled at that time. So how do you contact them? Well, if you're in Ohio or New Hampshire, you're probably close to one of their local locations. You're welcome to go in. If not, you can always reach them online at anewbh.com. And if you're interested in services for you or a loved one, use that address, helpnow@anewbh.com. Maybe I'm way out of bounds here, but I suspect that our America's dependence on stimulants has a lot to do with untreated ADHD. I really do. The whole don't talk to me till I've had my coffee, and those people who are like burning through energy drinks like 3 a day, and up, all the stimulants. Not talking about prescribed stimulants, but just the informal stuff. And sugar plays a role in that too, right? And so I think I don't know. My suspicion is they're treating a neurological disorder, but just sort of thinking like, no, I just really like going to Starbucks 4 times a day, so you're nodding, so I'm good. I'm not too far out of bounds. You think, does that make sense for what you see as well?
Yeah, definitely. And a lot of people that come to me who received a late diagnosis, once we start talking about their symptoms or their routine and what they do, they realize, oh, before my diagnosis and treatment, I was drinking 10 cups of coffee per day, or chugging energy drinks. So it's a very common story that I hear. So
And I share your pain on the ADD, ADHD person is kind of most like a caricature or like a cartoon character. Like they're just sort of like wacky and zany and oh, ha, ha, ha. There's some real suffering that goes on behind the scenes with this disorder, right? Because it's not like somebody's trying to be funny, or nobody likes to be treated like a cartoon character. There's a big difference between a mistake and I can't execute this, right? And so, I don't know. I mean, a typical, I don't want to say typical, but, you know, for people who are struggling with ADHD, other than like being late to a meeting or other than, you know, have to take time to find their keys, like what are the struggles? Like what are the things you're seeing them really fight through, and like what discomfort is that creating for them personally?
So a lot of people also have huge financial struggles because they can't pay a bill, and like they have the bill there and they should just pay it, but it seems almost impossible to do because oftentimes ADHDers struggle with doing certain tasks that seem very easy to someone who doesn't have ADHD, but it just seems impossible to someone who has ADHD. And if you say that to someone, it's like hard to believe because like you just need to do X, Y, and Z, or you just need to pay the bill. It's not hard, but to someone with ADHD can seem very hard and very difficult and like almost impossible. And then often they constantly bounce from like they're doing way too much. They're in hyperfocus, doing 10 projects at once because they're so excited about all these projects and they have a hard time saying no. And also they're impulsive, so they say yes to everything. And then they work so many hours and do so much, and then they crash, and then it's almost like they're in burnout. Then they're hard on themselves because they're not doing much. And then it's like a repeated cycle. And it's so hard for someone with ADHD to find balance because also these more extreme things like working on a lot of projects and accomplishing a lot of stuff also gives you like dopamine that you're, if you have ADHD, you're always kind of seeking. So it's really hard to find that balance.
When I work with clients or patients who are dealing with that, I often make the analogy, it would be like trying to drive your car if all you could ever do was smash the gas or smash the brake, and you have to drive your car home, right? Like that's kind of the life cycle of somebody who is dealing with this, right? It's full go, then it's a crash, and then it's full go, and then it's a stop. You know, there's no easing into any of this stuff, right? And of course, nobody would ever want to drive like that. Like, imagine living like that. You know, it's a real challenge. You hinted at the role of dopamine and things like that. So, brain-wise, chemically, you know, I know the behaviors and the symptoms, but what is actually going on in the brain? Is this just a dopamine deficiency? Are there structural problems? Like, can you see ADHD on imaging? Or like, what exactly is the mechanism in the brain that creates those needs?
So firstly, someone with ADHD, they have a deficiency in dopamine. And then also the dopamine gets taken up more quickly and metabolized. So it's less dopamine and then it's even gone quicker than in a brain without ADHD. And then they also have structural differences, like certain, like the frontal lobe, for example, is not as developed as in a brain without ADHD. So that's why they often struggle with making decisions or impulse control or emotional regulation.
It feels like we're seeing a lot more of this, right? And so the conversation is always, is it just better identification, better testing, better awareness, or is the dangers of ADHD, the presence of ADHD, the prevalence, is it actually growing? Because it feels like it's exploding. It feels like there used to be some, and now it feels like it's everywhere and so many people are suffering. So do we have more? Are we just seeing it better? Do you agree that there's an explosion? Like, what is your experience with that?
I think there's definitely an explosion in diagnoses.
Mm-hmm.
So far from the research that I have read, there is not an actual like overdiagnosis happening. It's just that a lot of people remained undiagnosed for such a long time, or now people are becoming aware of the disorder. Like, for example, if I look just at my family and all my relatives, I'm the first one to ever get diagnosed with ADHD, and I can see a lot of ADHD symptoms, at least in a lot of my family members. And my dad, for example, he was always called, in German, you have that word, it would translate to like a fidgeter. And people with ADHD were called like a fidgeter back in the day. And he was like always labeled that, but no one ever thought it could be something like ADHD. So I think it's definitely awareness is spreading, knowledge is spreading. People know or understand ADHD more, and it's not just this young boy running around in the classroom causing trouble, but it has like more, there's more to it than that. Then I also do see that a lot of, like at least here in the US, a lot of like online platforms are now diagnosing ADHD, which I'm not too sure about. I'm not quite sure about the process and how that works. But so far, at least the research suggests that there isn't an overdiagnosis happening.
As far as the online platforms, let's start there, I guess, and digging in. And I've had some suspicions there too. I like the access. I think that one of the big problems we have is access to care. And, you know, the average person has to drive 47 minutes for a psychiatrist. And, you know, that's a problem. And so I love telehealth and I love talking like this or whatever. I'm not a big fan of filling out a form online and then getting a diagnosis back, you know, so I think there's a line. What does it take, in your opinion, to get a legitimate diagnosis of ADHD? Is it as simple as talking to a therapist and the therapist going, hey, I think you got it? Do you believe in testing? Like, what do you think is the proper way to diagnose?
In-depth testing can be very beneficial because you never know, is it ADHD or maybe it's a different disorder and you could treat it in another way and that could really help the person. And there's a real danger also to misdiagnosis. So I do think that testing for ADHD and not just filling out a simple questionnaire is very, very important.
When you say misdiagnosis, what else can this look like? Or what are the things that like overlap that you think are important in terms of differential between one or the other?
There's also often like misdiagnosis with bipolar disorder, anxiety, or depression. It's also often common that it's the other way around, that at least I see that for a lot of women, that they first get diagnosed with either depression, anxiety, or bipolar disorder, and then later they realize it might actually be ADHD, but it could also be the other way around.
Yeah, and I think the differential within the ADHD subtypes too. So like inattentive versus, so can you talk about like there's different kinds of ADD and ADHD? Can you walk us through the basics on those as well?
So there's inattentive ADHD. So that's when you're kind of, I guess, labeled as a daydreamer. You're kind of in your head a lot. You have a hard time paying attention. And then there is the hyperactive type, which I feel like people kind of know mostly of. It's when you have trouble sitting still, you're very impulsive. And then there's the combined type, which you show inattentive symptoms, but also hyperactive and impulsive symptoms.
The lucky ones that have both.
Yeah. Yeah.
I have all the challenges. Yeah. So when you are dealing with that and thinking about treatment options and things like that, do you approach care and treatment differently based on the subtypes? Like what's different in how people can manage this and heal from this based on their type?
I don't focus too much on the type of ADHD or the subtype of ADHD, because it could also change throughout life, especially like from being a child to teen or teen to adult. And I really just focus in on their challenges. And then obviously that often is dependent on their subtype. But to me, I don't see that there is so much benefit in just focusing on the subtype.
That's good to know. That's actually really good to know, because I would think if you're struggling as a daydreamer versus the classical sort of like fidgeter, that maybe people would view those things differently, but you're saying there can be some switching. It can change throughout life. So you really don't need to waste a lot of time worrying about the subtype as much as how it's affecting your life overall.
Exactly. And I also see a lot of psychiatrists not really being specific on the subtype of ADHD. I think it really depends on who you go to.
And I think that's one of the more confusing parts about behavioral health is you can go to one practitioner and get one diagnosis and you go to another and get a different diagnosis. Whereas, you go to 10 hospitals with a broken arm, they're all going to tell you have a broken arm, right? Like it's pretty consistent. So
Yeah, exactly.
yeah. So how do we account for that? Like, how do you help patients understand that individual differences based on practitioner, right? Because the risk and fear there is for somebody to look at it and go, well, this isn't real because you said one thing and this person said a different thing. So how do you deal with that concern? Or what would you say to those folks?
I would tell them that if they got a diagnosis and they do feel themselves confident about it, then it's already a very good sign that this is probably most likely their diagnosis. And a lot of people who were then misdiagnosed and then later on got their ADHD diagnosis, they come to me and tell me that they never really felt like they had that misdiagnosed disorder, and it always felt off, and they didn't feel like the symptoms really matched. So I feel like sometimes you also know that yourself, and once you talk to also the psychiatrist or the mental health practitioner, you get a good feeling of if they kind of know what they're talking about or if they even have knowledge in that mental health disorder, because not everyone specializes in every disorder out there.
Yeah, it's a little bit of a Cinderella phenomenon where you have to find the slipper that fits, right? Like, and then, okay, this feels right and this makes sense. And the other piece of that is that's really important to me, and I've talked about this on the show a couple of times, is it's really a relationship between you and your provider. It's not going to see the guru who has all the answers and can like diagnose you on site and say, take this pill and do this exercise and you're all cured. I mean, it really is an ongoing relationship, and you should feel like an active consumer. If a diagnosis doesn't feel right, tell your provider, say, I don't know if I'm seeing that. Like, help me understand why you chose this over that a little bit more. And then maybe more stuff comes to the surface where they go, oh, because I saw A, B, and C. And you're like, yeah, but what about D, E, and F? And you're like, yeah, well, you didn't tell me that, right? So there's more comes out that, that helps make a difference. I mean, because there are hundreds of potential diagnoses at this point.
Exactly.
It's really hard to sit down with somebody for an hour and nail it perfectly the first time. You know, you can get close, but it does evolve over time. And ask questions. Don't be a passive recipient of your behavioral health. I mean, it's going to change everything about how you live. So you should ask questions and give and take feedback that way. So, do you see a lot of, you talk about your family, is there a heavy genetic component of this? Like if I have ADHD, am I likely to give it to my children?
So there is a heavy genetic component, and it's mostly due to genetics, but it can also be due to environmental factors and so on. And obviously there's more research needed, but so far the science suggests that it's mostly genetic. So there is a chance that if you have ADHD yourself, you could give it to your kids as well.
I'm asking like highly specific questions here, but like if myself and my partner both have it, does it double my chances? Does it triple? Like, is there more? Is it sort of the same? Like, do those risk factors multiply?
Yeah, it's, I guess, just the same as if you and your partner have black hair, you're more likely to give your child black hair. And depending also on your like grandparents and your parents, do they have like black hair, or do they have blonde hair, or do they have brown hair? And then that mixes into the genetics. But if you both have ADHD, then obviously the chance increases by a lot.
Well, I think the environmental part is important too, because if you both have ADHD, or even you do, you're going to also display a lot of sort of disordered behaviors that your children are likely to internalize. You know what I mean? So do you work with parents at all about, you know, reducing the risk with their children, or what they can do if they know those risk factors in place? Do you coach or work with families on, okay, this is part of your story, here's what you can do to make it less likely for your children, or to help blunt that effect a little bit?
No, I do work with parents, however, just to know how they can like parent their kids in a way that is like ADHD friendly, or talk to their schools, their teachers, counselors in a way to support the child even more, so that they just struggle less when it comes to like life in general.
Are there any top of mind, like sort of ADHD friendly practices that you recommend?
I would never recommend negative like punishment for, I guess, in general, but particularly for someone with ADHD, that usually never works. And also asking them what they need, because I feel like so many times parents or caregivers try to like find the best way to parent their kids, but then they never think of asking their kids themselves, maybe how do they learn best? What do they enjoy about doing homework? How can we make it more fun and enjoyable for them? Or what part of school do they like? How can we focus more on that if they have a hard time going to school? And just really connecting to your child and not forgetting their voice when it comes to all these decisions.
I think that's beautiful. And Ian, we should mark that. I hope that gets into the shorts and the reels and the TikToks, because I do think kids are sadly just kind of along for the ride for a lot of their childhood and a lot of their educational experience, right? Then they turn 18 and we're like, be an adult. And you're like, I haven't been treated like an adult yet. You know what I mean? Like, how in the world would I have any of these skills, you know? So I think that's really important to work with your child and get their feedback and just ask, right? You can buy a bunch of books and maybe this doctor says this and this doctor says that, but your child may tell you, here's when I struggle and here's when I thrive, and let's do more of what works and less of what doesn't, you know? Why doesn't negative feedback work with an ADHD child? Is that just personal experience, or is there more to that?
I think they're just often then become very stubborn. I mean, I think for children in general, or people in general, that's a natural response. But I see that a lot in people with ADHD, and ADHDers in general have a hard time doing what they're being told. And especially if they don't understand the reason, because they often want to know the why behind it. And if they don't understand why something needs to be done, then usually they don't do it. Yeah.
You're not invested. You're not curious about it anymore. It's like, this is arbitrary and it's dumb and I'm not going to deal with it. Yeah. Don't hit your kids. I mean, that negative parenting, like, it just doesn't make any sense. Forget diagnosis and disorders. Like, it just doesn't, it doesn't work. Doesn't work. So you have somebody who comes to you and, they have the diagnosis. How do you begin your work? Like, what is the goal? Like, what are some of the tools that you try to equip them with? Because I know you talked a little bit about the topics you focus on, but how do you actually sort of dig in and start, creating opportunities for progress with a client with ADD or ADHD?
It's always obviously very individualized because everyone has their own struggles, or they do struggle in a different way and they have a different learning style. So it's always very individualized. So I ask a lot of questions to see kind of what their day-to-day life looks like and when do these challenges kind of play into their routine or their like day-to-day life or work or school. And then I go from there and we talk about things that they could try out that could help them. And for example, some people love using planners, but others hate it. So it's always very different from person to person. And that's what I kind of try to find out, what tool or strategy will actually work for them.
Yeah, I hate planners. I'm in that category. It feels like because to me, it feels like an extra step, right? Like, I have to do the thing and I have to like document the thing, like all, it just feels like, why am I doing this twice? So, but they're very helpful for some other people. No judgment,
I do feel like a lot of people dislike planners, but then as you said, there are some people who do like it.
One question that is kind of implied here that I really want to ask about, and I really want to dig into this. So you've shared that you have an ADHD diagnosis yourself. And you also have shared that you had a really hard time in school. But you're a doctor and you're accomplished in your field and you've made it through probably several degree programs to get where you are. You maintain viable employment and you're a productive member of society and you're smiling a lot, so you seem fairly happy. Like, what are your secrets? Like, what do you do sort of day in and day out, and what did you do along the way to help you accomplish these things despite your diagnosis?
Firstly, just having a good support system, good friends, family around you. I feel like that's very important for me, and I know not everyone has that, but that was always very important for me. And also just then being able to ask them for help or support. That was always very great, especially during school. And then during university, I really was lucky to find something that I loved and still love to do. And again, I think not everyone knows what they want to study. I mean, most people are like 17 or 18 when they get out of school, so it's hard for a lot of them to know what they're actually passionate about. So really focusing or thinking about what is something that you really enjoy and you are interested in learning about, and then when these hard times come, and they will always come, being open to ask for help and to ask for support, or if you have a diagnosis, ask for accommodations, and also observing yourself and seeing when do you work best, when do you not work best, what works for me and what doesn't. That was always very, very helpful to me.
I come from a solution-focused background, and I mean, regardless, diagnosis, no diagnosis, or whatever your diagnosis is, that's really kind of the core of a lot of my work is like, there are moments when you are thriving, right? And even if you're not thriving, you're not struggling to the same degree as you are in your darkest moments, right? And so, giving due process and due attention to that and harvesting those wins and creating a structure that amplifies your strengths while reducing the things that hold you back, I think is the recipe for success for everybody, regardless of their condition. I mean, it just is, something as simple as, if you're a big guy like me, don't become a cross country runner, like play football, right? Like you have to find the things that like fit you. And it's a big world. There's so many of us and we all have our each individual strengths. Like there is a place for you. Regardless of what your strengths are. Even, when I was growing up, like video games, people were like, oh, don't waste all your time playing video games. There are people who make millions of dollars playing video games right now. You know what I mean? So you can find your niche and it's already there. I don't have to give you anything new. I don't have to create a new person. Like it's inborn, it's natural to you. And if you can find that and harvest those strengths, I think if nothing else, you're gonna be a lot happier than if you are just trying to fight your weaknesses. So it sounds like there's elements of that in your work as well.
Agreed. And I feel like comparison is often what really pulls us down and pulls us into these dark moments, because then we start comparing ourselves. Like you said, oh, this person is a cross-country runner. He's so much faster than I am. Like, why am I so horrible at this? But then we often forget to look at all these other parts of our lives where we are doing so well and we're doing very good and we enjoy what we do. And then we usually tend to focus on all the negative aspects.
And comparison is the thief of joy, right? And so now throw in Instagram and throw in TikTok and throw in social media, and you wonder why our kids are wandering, walking around with all that context shifting and inability to focus, negative self-esteem. And it's like, well, because look what they're looking at every day. I mean, everybody's on perfect lighting and they're on vacation, and there's AI programs that'll give you muscles and fix any blotches on your face, and everybody looks so perfect. And here I am, So I think that's a huge trap.
Yeah, and that definitely makes everything so much harder because it's so accessible.
Yeah, and then throw on COVID, which sent everybody to their devices, right? Now we have these ingrained behaviors, and wow, I guess maybe we start off the show talking about why there's so much ADD. Maybe we should have started talking about why there's not more, because it feels like there's some real social recipes for this to happen. Let me flip the question around. So you've talked about some of the things that are helpful to people with ADHD. Do you have a list, or do you have any common like don'ts for people on ADHD, whether it be diet, nutrition, gobbling these stimulants? I know it helps in the short term, but overall, does that make things worse? I mean, are there things that people who have this diagnosis that they should avoid or they should not do?
I feel like a lot of ADHDers, especially if they not get treatment or they haven't found the right treatment for them, they tend to then turn to as I already earlier mentioned, like drugs, risky behavior, something like risky driving. And that is really a big don't, because then it can get so hard to get out of there and out of that behavior again, and to like find that balance again. So that's definitely a very dangerous pathway.
I worked in addiction for a long time, and ADD, I think, led a lot of people there because, like I said, they look for those outlets and ways to cope. And, if a little stimulant is great, a lot of stimulants would be even better, right? That's the thought. And then, habituation happens and they need more and more to get the same effect. And next thing you know, it's off to rehab, and that's, lives are devastated behind that. That's a tough one for sure. Do you have any common resources? Or do you have, like, when people come in and they want to learn, or somebody, like if somebody's listening to this and they're thinking like, well, maybe I do have this, or I've been told this before, how should they investigate the matter? Like, what's the first step? Should they come see somebody like you? Should they go to WebMD? Like, what should they do as they're investigating whether or not they have this?
I have a ADHD resource guide on my website, and that kind of lists all the facts, what it looks like, what are the treatment options, what are your options? How would I even ask for a diagnosis? Is there any way I could ever feel better? And if it's not ADHD, what could it be? So that is like a nice short summary if someone wants to read that. And I think it would be important just in general to research the topic of ADHD a bit more, get an understanding of what it actually means, and to see, could it actually be ADHD, or am I just constantly like too tired to like focus or pay attention, and that's why I constantly lose everything. And then it would be important to talk to a mental health practitioner, or to a psychologist, to a therapist, and ask them for support and resources, and maybe also ask them for the next steps and what their options are if they can already get a diagnosis. Because I know it really depends from country to country, state to state, on how the kind of steps are and how it's treated. So, but I would definitely say research some stuff yourself and then ask for help and get the help.
Well, and sadly, part of the story in this country, we talk about it's different country to country, state to state, is start with your insurance coverage as well. You have to make a phone call and go, what are my options? What's covered by my plan? If you don't have insurance, you're on Medicaid or something like that. There are a lot of options out there. It doesn't mean you're disqualified from care. There's this illusion that if I don't have, Blue Cross Blue Shield, I'll never get good quality help. Anew, behavioral health, my company, we see both. It's the same therapist. So there's no difference in care. So there are a lot of options, but you do have to start with like what's possible for me and kind of investigate that. We've just crossed over an hour, and I want to be respectful of your time. I know whenever I have psychologists or psychiatrists on here, I look at their calendars and I get instant anxiety, because I'm sure yours is just like back to back every day of your life, which maybe is good for your ADHD. I don't know. But if you're doing something you enjoy. But one topic I do want to ask real quickly. So for a lot of people, when they get into treatment for this, medications are a big part of the story, right? And so we've heard of Adderall and Vyvanse and Strattera and all the different ones. There's stimulant-based, non-stimulant-based. What is your, I don't want to say opinion, because there's a lot of evidence that these are very helpful, but do you encourage your patients to incorporate or at least consider medical interventions? Where do you kind of stand on that issue? Are you pro? Are you anti? Are you kind of case by case? Like, where do you fall on the medications for ADHD issue?
I would say I'm very case by case, because it really depends on the person and what they need. As you said, some people have amazing benefits from taking medication, and it saves their life. Versus other people, they might not even qualify for the medication because their BMI is too low, or they have heart issues, or they had a drug addiction. So then medication wouldn't even be in the picture. So it really depends on you and also what type of ADHD medication you want to take. The doses, do you want to take it whenever you feel like you really need it? Or do you want to take it every day? Do you just want to take it during the week and then have a break on the weekend? So it really depends. What I always do suggest to all my patients is that I wouldn't just take the ADHD medication alone, that you also should consider therapy or coaching. It's just that combination approach has been shown to be most effective for patients with ADHD. So I wouldn't just rely on ADHD medication.
Yeah, I'll second that motion. That's a big one, because that's meant to provide you with some stability so that you can do the other work. And maybe someday you don't have to take the medications, or you can reduce your dosage, or you can, or maybe you take it for the rest of your life. But with those behavioral interventions, you're going to multiply and amplify the impact. It's like everything else. If you're trying to lose weight, it's diet, it's exercise, it's medications. If you do one, you'll get some benefit. If you do all three, you'll get a ton of benefit, and they all work together. So that's great. Okay. So listen, Dr. Janina, this has been awesome. I'll do a quick wrap up. I went over, I promised you an hour. It's a minute, it's 4 minutes over. So, please forgive me. I have time blindness and I forgot that we had to stop right there. So, but I really enjoyed this, and we will be posting your resource guide for sure below. But other than the resource guide, how do people find you and connect with you?
So they can find my website under ADHDempowerment.com, or on Instagram, also ADHD Empowerment Coaching. And
you're a pretty active poster. I've seen that, you've got some good content on there, and so that keeps it fresh, and that's really, really good. So thank you so much. I appreciate your time. And for you guys watching, obviously check out Dr. Janina's stuff. It's not just Connecticut. You can work worldwide, right? You don't have to be within like a New England area. You can anywhere, and somebody needs help, you can connect.
Worldwide, yeah.
Worldwide, all the places you've been, basically. So you just you traveled the world, and now you're helping the world. And I appreciate your efforts with this, because ADHD is so prevalent. It's a very difficult issue. So if you are in the New England area, you want to check out Dr. Janina's work, please check out the links below and those addresses. If you are in Ohio or New Hampshire, I always give a shout out to Anew Behavioral Health. They sponsor the show, which is awesome. But on top of that, they work with issues like ADHD, ADD. They do have psychiatry and therapy. So that combined approach is very possible. Nurses to monitor the impact of your medications. You can find them at anewbh.com. Or if you need help immediately, you can go to helpnow@anewbh.com. So with that, we will wrap and we will call it a day. Producer Ian, thank you so much for driving the bus, man. We had a good time. People don't see the behind the scenes cuts, but we had a rough start. We had technical issues. We had a TV problem. We had a camera problem, but Ian made it all happen, and I appreciate you. So thank you for that, sir. He's nodding, so I'm nodding, but he acknowledges my compliment. He forgets he's on. Your camera's not on, dude. We had to use your camera for this, right? So we don't get to see you, but he nodded, and that's good. Thank you, Jason. And Dr. Janina, once again, one final thank you. Thank you so much for your time. I really appreciate you being here.
Thank you so much for having me on here. It was so much fun to talk to you and have that great conversation.
Absolutely. We'll do it again real soon. We're not too far away, and this is a topic that comes up a lot. So the final thank you, like every show, is for you guys watching at home, in your car, if you're listening, whatever. Time is your most valuable asset. We are honored that you shared some of that time with us, and I had a great time. I think we learned a lot. I hope this was very worth it for you as well. And until next time, take care of yourself. And take care of each other. I appreciate you. Bye. Hey guys, although Through Help and Back is an excellent podcast with a lot of great ideas, I do want to let you know that in no way is Through Help and Back expected to be perceived as or relied upon in any way as specific medical advice or mental health advice for you personally. The information provided through Help and Back on our website or our podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment that can be provided by your own providers. Do not use our content in lieu of professional advice given by qualified medical professionals, and do not disregard professional medical advice or delay seeking professional advice because of the information you have read on our website, heard on our podcast, or otherwise received from us. Although we love discussing issues related to healthcare, mental health, and addiction, we are not providing direct healthcare, mental health care, medical, or nutrition therapy services. We're not attempting to diagnose, treat, prevent, or cure in any manner whatsoever any physical or psychological ailment, any mental or emotional issue, disease, or condition. We are not giving you specific medical, psychological, or religious advice whatsoever. Please take care of yourself and take care of others as you always seek the advice of your own medical providers and your own mental health providers regarding any questions or concerns you have about your specific health, or before implementing any recommendations or suggestions from us. These are ideas that have worked for other people. We think it's important to share them. We do not guarantee that they will work for you specifically. Do not stop taking any medications without speaking to your physician, nurse practitioner, physician assistant, mental health provider, or any other healthcare or medical professional. And if you have or suspect that you have a medical or mental health issue, contact your own healthcare provider promptly. Also, one last thing, if you know or suspect that you are currently experiencing a crisis, it is absolutely imperative that you seek the advice of your doctor or other emergency healthcare services prior to ever thinking about using our content. We love the conversations. We're glad you're stopping by. We hope you take a lot from the content. But again, for your specific individual medical situation, please always seek quality personal care from your own providers. Do not let this information or this advice stand on its own. Thanks so much for listening.